Best thing to do.
Good evening, gentlemen and ladies. I'm standing in for Tom tonight. He's on a railroad coach somewhere between Dallas and Phoenix, Arizona, someplace. So he's enjoying a night on the rails. So I'm here to stand in. So bear with me. I will give his usual speech, and I think, a shorter work week, I think. Remind me to talk about that. But anyway, so this is the 445th meeting in Dallas. Of course, as you know, the College of Complexes started in Chicago, and then Tom brought it down to, when he left Chicago for warmer climes, that's to say Dallas, then he brought it down, and it's been going here for, 10 years or more. So anyway, so we're happy to have it. Anyway, we put on a different speaker each Saturday on various topics, and so the speaker is allowed to speak and shouldn't be interrupted, because we have the motto, only one fool at a time. So remember that. And then after the speaker has spoken, we give him an hour, or her an hour, rather. And then after that, we have question and answers. Usually, hopefully, the speaker could answer the questions you might want. And then, of course, we have 5 minutes are allowed for rebuttals. And then after that, the speaker has the last word. He can rebut all the rebuttals. And so, before I start, are there any announcements? Ken, do you have an announcement?
Philosophers Forum is meeting on the 12th at El Phoenix off of Skillman and Adelia. And I forget what the subject is. But
some philosophy.
Yeah, some philosophy. Some philosophy subject. Yeah. But yeah, it's $5.
Yes, you have an announcement?
This Thursday at Temple Emmanuel at 7 o'clock, they're having a symposium. Rabbi Stern is leading it, and on artificial intelligence.
Oh, okay, that should be interesting.
I think
Yeah, how does one approach documenting truth is what our talk is
I
about.
hope so.
So, anyway, tonight we have the pleasure of welcoming Jake Varghese, and he will talk about heaven on earth, but it's more to do how to re-architect society to make it work better. I think I will paraphrase that. Anyway, without more ado, I won't bore you anymore. So, have at it.
So, hi everyone, my name is Jake Varghese. I'm a professional software architect and amateur policy architect, and today I'm going to talk to you about this. Building heaven on earth, a framework, and some examples. And the most important part of today's talk is this part, the framework. It underlines everything. I have some example blueprints I'm going to show you about policy that we can create from the framework. Now let's talk about frameworks. I can't walk. Let's talk about frameworks in general. As an engineer, if we didn't have frameworks, nothing would work together. Everything would be it would just fall apart because nothing would interoperate with each other. If an engineer doesn't have a framework, they will just design to their own imagination. So if you have 10 engineers without a framework, there can be 10 different solutions. You have to have a framework to give them something to engineer to. So a very common example of this is languages. We have the framework of letters, and then we have the framework of putting those letters into words, and the framework of putting those words into definitions, and then the framework of stringing those words together into sentences. Now let's look at two languages, American English and British English. Okay? We have the same letters, the same words, and as far as I know, mostly the same definitions and the same sentence structure, but I can only understand them 50% of the time. Why is that? It's because we've slid off of the framework of the language. I have 3 British engineers on my team. I can only understand them when they're talking about engineering stuff. Because we have an international framework for how we talk about engineering. When they're talking about their personal things, I barely understand half of the things they're talking about. I'm guessing they're talking about drinking, but I'm not really sure. So that's why frameworks are extraordinarily important. Right now, when we build policy for society, we don't actually have a real framework, a purpose-driven framework. All we have is a framework of laws from our Constitution.
So, why do we live in society? Our natural state is in the jungle, but for some reason, we come together as society.
Other side.
Well, it's pretty simple.
Back.
Because we are animals. It is manifestly evident that we are superior to everything in the animal kingdom and everything else in material creation. We're better than the plants, the rocks, the microorganisms, the animals, everything. Can animals observe the universe? Can they create poetry and art? Can they contemplate existence? Only in Disney movies. Animals in the jungle live in a constant state of survival. A human in the jungle behaves exactly the same way. So where does this come from? Where does this urge to live in society come from? It clearly doesn't come from nature or anything else in material creation. If it did, then the animals, the plants, and everything else would also have society and civilization. They don't. We know it doesn't come from there. So where does it come from? Well, it's pretty simple. It comes from the spiritual side of our existence, not the material side. Thus, society is a spiritual concept. And let's use this as the first principle of society. The foundation for everything that emanates from society. Everything we build needs to be on this foundation. When we allow materialistic institutions to thrive in society, all we do is create a jungle inside of society. And a jungle inside of society is worse than the jungle of the real, natural, material world. In the jungle of nature, you have a chance of survival. You can try to get food by getting up a tree and getting fruit or nuts or killing meat. You can build shelter somewhere. In society, we don't allow that. We need currency to get food. We have property rights. So we need to alter our foundation for policy making. We need to constantly ask ourselves, does this policy start from a spiritual, social, moral point of view, or is it a materialistic one? If it's simply a materialistic one, all we're going to do is create junk. And at every step of the implementation, we must check to see if we are still on the foundation or veering off. And it's not just in the implementation. During the analysis of the problem and the solution design, we have to check also. We need to ask ourselves, what is the true benefit to the average citizen? Are we helping the least of these? Should we allow an institution to exist that can bring harm onto society? Should we allow social processes, i.e. the economy, to exist solely for materialistic reasons, like money? Should we allow an institution to exist that can poison our food, or our water, or our air, or our public discourse, or our children, or our education, or our health, or our minds? As an engineer, we know that when we look at a problem, we don't immediately solve the problem put in front of us. We make sure that it is the core problem and not just a symptom of another problem. When I look at society and I look at all the problems we have around the world, I keep coming back to this. Our materialism and arrogance are killing us. We are allowing anyone to poison anything as long as they make money. This cannot go on. It's not sustainable. We need to replace the materialism and arrogance with spiritualism and humility. What we need to do is build a society and a planet whose foundation is firmly upon do unto others as you would have them do unto you. This is what our new foundation for society should be.
This. 2,000 years ago, we were given the most powerful sentence our existence has ever seen. This was supposed to be the foundation of our existence. Every action we ever took was supposed to be measured against this. This is what it means to be a Christian. Now just think about that. Just think about what would happen if we rewind history all the way back and just think about Christians. Forget about the Muslims, forget about the Hindus, forget about the Jews, forget about the Buddhists. Just Christians did this for every action they ever took for their entire existence, no matter how much power they gave. Every king, every lord, every duke, every priest, every monk, every bishop, every pope, they did this. What would this world look like right now?
Pretty different.
Yeah, we would already have built heaven. We'd be maintaining it right now. This is the foundation of heaven. This was always meant to be it. We have to build everything on top of this. We can't build heaven without it. Justice and ethics sit on top of this. Anyone think of anything that's ethical that falls off of this? I can tell you lots of unethical things that fall off of this. When you do unto others as you would have them never do unto you, that's just corruption. Justice and ethics need each other. Ethics needs justice because something needs to enforce justice, or something needs to enforce ethics. And justice needs ethics so that justice doesn't dispense injustice. If there's no ethics in justice, we will dispense injustice, which we have plenty of examples just in our time. Any society not built on this foundation will decay into corruption every single time. Every single time. We have plenty of examples to show us this. This is what we're supposed to build a society on top of. All of our policies have to be on top of this, somehow. We can either push them there or remove them, alter them, or update them. So this is the framework. So now I'm going to show you some example blueprints to show you what policy could look like when it's on top of this framework. The policies that I chose are just 3 policies that we happen to be talking about now: healthcare, affordable housing, and just corruption in general. So the first one I want to talk about is an immune system for society, the court of ethics. Right now in Nature, actually this is an article I wrote. I'll give you guys the links to these articles. They're all on my Medium page, so I'll just scroll through these as quickly as possible. So in Nature, everything already comes pre-built with an immune system. It comes pre-built with defenses against corruption, protection against corruption. We can protect against germs, bacteria, toxins, viruses. And when a person has a healthy immune system, they don't really need that much external assistance when they get sick. Any doctors or nurses here? Anyone know what happens when you don't have an immune system?
You get sick, you're better.
Okay, every single thing can be fatal. And you always need external assistance. You always need a doctor helping you. This is exactly how we built our institutions. We didn't build them with an immune system inside of it. We built them so that they have the immune system outside of it. They have external assistance to deal with ethics. So my proposal is a 4th branch of government from a constitutional amendment that gives us a court of ethics in the district courts. This court would not directly deal with the citizen. It would directly deal with the government. So it's indirectly dealing with the citizen by keeping the government institutions safe and free of corruption as much as possible. Now obviously, just like when you have a healthy immune system, doesn't mean you don't get sick. It just means you can deal with it quickly. So that's the point. Right now, we don't deal with that at all. So it just keeps building and building and building until it explodes out in front of us into some corrupt scandal. And then we have to call the IG in to do something. And this is the worst part about our ethics system in the US. our ethics system in the US stops just short of actually enforcing the law. It stops just short of enforcing ethics. If you've ever read an IG's report, they're wonderful. Oh, we have some wonderful standards for ethics. We just don't enforce any of them. This is the problem. So this system would create a new branch that would mimic the Article 3 branch, and it would give us a court of ethics. And what we would do is we would dissolve all the ethics agencies inside of the Congress and inside of the executive branches and move them under this new independent branch. So they're completely outside of control of politics and outside of the corruption. You can't have the corrupt telling themselves that they're going to indict themselves. It never makes sense. That's like the mafia saying, yeah, we'll take care of that robbery real soon. That's not going to happen. And also, this would allow the IGs would be moved over there also. And the IGs would now have prosecutorial powers. So they're basically like US attorneys. And they can go anywhere they need to. So their power would be moved under this new branch, but their actual physical location would still be inside of the agency. So they can see everything. There shouldn't be anywhere they can't see. They should be able to see every single dollar, every single email, every single memo, unredacted. They are the immune system, so they have to be able to see everything. If there was a part of your body that the immune system couldn't get to, that would be the part of your body that would always get sick. We have to make sure that the immune system can get everywhere. Otherwise, corruption will just flow into the part that the immune system can't get into. This court would also be able to dispense punishment. So just like crimes, jaywalking and murder aren't the same things. I don't care if someone jaywalks 100 times, but I do care if someone murders once. So we have to grade our ethics and our punishment accordingly. So the first punishment would probably be a reprimand or a warning, then extensive training, fines, garnishment of wages, removal from office, and then banishment from public office at any level for any specified time or forever. And if the problem is so egregious that it warrants criminal action, this court system can hand over the case to the Article 3 courts to prosecute for criminal charges. And since this court is keeping all the other courts clean, there will probably be really good prosecution going on and actual justice being dispensed. So the entire point of this is to keep our government institutions clean and free of corruption as much as possible. This also, that takes care of the federal level, but what about the states? Well, that's where the district courts come in. Because the states also have really good ethics guidelines. Texas has a Texas Ethics Commission. Wisconsin has the Government Accountability Office. Louisiana has a GAO, and I think Missouri has a GAO. Nearly every state has something to deal with ethics. But they have the same problem as the IGs. They can just report. No one does anything about these reports. So now, these offices would be able to hand over their reports to the district IG for prosecution. So now a governor can be removed, a lieutenant governor can be removed, an attorney general can be removed, or really corrupt legislatures can all be removed, all the way down to the local level. Any position attached to government under the Constitution is now under this purview. They are now under this immune system. So if you want to go ahead and read more in detail, I go over a selection of judges because the way we select judges is inside of the corrupt process. It starts inside of politics. I actually take it and remove the selection of judges outside for a group of lawyers guilds. They'll be the ones that do the checks and the selection, and they hand it over to Congress for confirmation and then to this executive for signing. And also it talks about removal of ethics judges because corruption is everywhere. It will get into our ethics courts too, so we have to have a way of removing ethics judges and judges and IGs. So that is it for the immune system. The next policy blueprint I want to talk about is healthcare. For me, Medicare for All is just a freaking no-brainer. I mean, as an engineer, looking at our system that we had, it's clear that Medicare for All would have been way better, more preferable, more effective, and more efficient, and faster to set up than ACA. Why? Because it's already built. Infrastructure is already built for Medicare for All. Every company knows how to pay Medicare. Every hospital knows how to bill Medicare. That part's already done. Now we just need to expand it to everyone and adjust the taxes. Right there we have a baseline for Medicare for All. This blueprint actually supercharges that to increase the quality of service and effectiveness and efficiency of an entire national healthcare system. How many of you have heard of HR 676? It's the Medicare for All bill in the House. It's very good. If it passed on its own, I would be ecstatic. It actually captures many other things in this list to one degree or another. and everything else can just be added to it later. So the first thing I would say is negotiate prescription cost. It's so dumb that we don't do this. In Canada, in some medication, it's like an order of magnitude difference. In Maine, it's $100 for a supply of 60-day supply, but in Canada, it's 10. That's just very stupid that we do that. We know they make those medications here, and then for some reason, when they go to Canada, it's $10, but here it's still $100. How is that possible? It's because we don't actually negotiate. The government can negotiate for every single thing it buys, except this. We can negotiate on planes, on jets, on tanks, but not drugs. Why? Obviously, we already know why. It's corruption. So, number 2, well, actually, the other thing I want to talk to you about is HR 676 has a way of doing this that's actually really, really good. What it does is it looks at the top 25 advanced countries, finds the top 100 medications that Medicare pays for, and then finds out what the median price of all these countries pay for. That right there will drop our pricing by 60%. And in some cases, we can actually do our medication for free. Number 2, add mental health, dental, vision, and home health care to Medicare coverage. This, again, is something that's boggled my mind ever since I was basically gone to the hospital and just understood insurance. Why don't we have mental health and dental and vision? That's so dumb to me. You need your eyes in order to be healthy. You need your teeth to be healthy in order to be healthy. And you need your mind to be healthy in order to be healthy. This should all be part of coverage. And in all the other advanced civilizations that have this, have universal health care, this is part of their coverage. That's why it's so much cheaper. Because when we put everything together at the scale of the country, we can dramatically reduce the cost and increase the effectiveness and increase the efficiency. So if we add all these to the coverage, it would greatly increase the quality of healthcare for us right now, just immediately. Number 3, to Medicare's mission, we should direct Medicare to focus on high quality, preventive, integrative healthcare. Preventative healthcare is basically the best way to do healthcare. It's very simple. Why? Because it prevents sickness. We're preventing sickness. Sickness is what costs us money. If people don't have to go to the hospital, we don't have to charge them for it, so it doesn't cost us any money. Secondly, nutrition is healthcare. This is actually part of 3, but I just wanted to break it out because it's very important. Some of the new preventative healthcare medical research is showing that if we just feed people nutritious foods correctly, they stay healthy. We can reduce diabetes, heart disease, COPD, and many other chronic diseases by just feeding people correctly. Feeding people nutritious foods gives them the nutrients that their body needs to fight off infection. So my idea is just give everybody money to eat. We can take WIC, TANF, and SNAP and put it all and roll it all into one program and just give everyone money, even the rich. It's fine. We just won't give them as much money. It's cool. So if you make over $240K, you get $100 per adult, and then first child is $150, second child is $100. So if you're a family of 4, you get $450. If you're making over $240K, you get $450 per month to buy nutritious food for your kids and your family, because that keeps them healthy. It's cheaper to pay the farmer up front than 2 orders of magnitude later to the doctor. And if you're at the poverty line, or not at the poverty line, at the median wage, which is like $65K, you'll be right here in this range. You get $350 per adult, $250 for the first child, and $175 for the second child. That's $1125 per month to buy highly nutritious food for your family in order to keep them healthy. And we have to also make sure this food is free of toxins and poisons and other synthetic chemicals, because all that stuff really diminishes the nutrients in the plant and in our food. So that's for nutrition. Number 5, allow Medicare to build purchase hospitals. Cleveland Clinic, Mayo Clinic, UCLA Med, Johns Hopkins, San Francisco Jet, and Boston Jet. These are the top 7 hospitals in the country. All these hospitals operate on almost identical processes. They have salaried staff, salaried doctors, salaried nurses, patient-centered care, and they encourage collaboration across the disciplines. So if your doctor thinks something's wrong with your heart, he doesn't have to create a new referral, make a new appointment, and do all this other nonsense. He just goes to the doctor, the heart doctor, and says, hey, can you check this out real quick? And they do it. That turns out to be way cheaper. Here's the cool thing about that system. Those hospitals we already know are the best hospitals. The rich flock to them because they have ridiculously good care. So we already know their quality is high. We already know that their provider satisfaction is high because none of the doctors or the nurses are complaining about how much they get paid there. They're all very happy with how much they get paid there. So the providers are being treated excellently. So we have high quality service, high quality satisfaction for providers, and high quality satisfaction for the patients. But here's something most people don't know. These 7 hospitals, on average, spend 15% under the Medicare average. So they also save us money, a lot. After ACA passed, Medicare was given the ability to do a new type of payment model called the Accountable Care Organization. They paid bulk payments to the hospital for the patient. Cleveland Clinic did this and saved Medicare $42 million in the first year they did this. It is a ridiculous amount of money that we can save if we just take that system and say, look, you guys clearly know what you're doing. We're gonna make you the template for all hospitals. And you're gonna be the ones that create that system. We're gonna be the ones that pay for everything, but we're gonna use your system. We trust you to do what you've done, because for 40 years, everyone knows you're the best hospitals. So we take that system and we multiply it all over the place, and we can save a ridiculous amount of money because of how much they already save. And then we add on top of that, they can also build out little small clinics, like in rural areas, with the same type of collaboration and patient-centered focus. And this would save us even more money on all these, because rural healthcare is actually very expensive, because A, no one wants to be a doctor out there, and B, they don't always have, the people there don't always have the best insurance, so they're getting very, very sick by the time they go to the doctor. This costs much more money. So number 6, add a QoS feedback mechanism, basically allow Medicare to be reviewed by every patient, every provider, medical staff, and medical personnel. This would actually help us get rid of all the bad personnel, which is not really going to be at the provider level and down. I'm worried about the personnel inside of MMS, because that's where we put political hacks and political appointees into. If we create a QoS feedback mechanism, this could push them out and remove space and free up space in order to put better people in. The same thing with doctors and nurses and staff. This would actually help hospitals figure out who their better doctors are, push out other doctors, and bring in new, better doctors, so that the quality of the care is always improving continuously through the years. Number 7, make the Medicare taxes progressive, and I bracketed them up to $1 billion. So right now, HR 676, the only problem that I have with it is how we pay for Medicare. Both of these systems will pay for Medicare. The problem is how we pay for it. So HR 676 uses 4 indirect taxes to pay for Medicare for all. The financial transactions tax, the stock tax, medical device tax, and then some other tax that I forgot. The problem is, 15 years from now, when everyone forgets how we built Medicare for all, whoever wants to tear down Medicare for all will start saying, hey, the financial transactions tax, that tax is too much. We need to bring it down because it's a burden on the economy. It's creating drag on the economy. And then people will just be like, oh yeah, well, I guess that's true, so let's take it down. And then 2 years later, we'll have to cut benefits from Medicare because everyone forgot that tax paid for Medicare. So what I say to you, make it a payroll tax, just like Social Security and Medicare. One of the reasons Social Security and Medicare are so politically toxic is because the politician has to say Medicare. They have to say Social Security. They can't just say financial transactions tax, which doesn't sound like it has to do anything with Social Security and Medicare. But because we made it a payroll tax and we line itemed it on a payroll, everyone knows where that money goes. That's exactly what we need to do with this. Make it so that it's clear to everyone where the money comes from and where it goes. So just make it another payroll tax. So right now, this first column here is the Medicare Classic Tax. This is what we already pay, 2.9%. And actually, after 780K, I started to bump it up a little bit. It's 3.25%, 3.5%, all the way up to 5%. This would help pay for dental, vision, and home health care coverage for the elderly. Also, it would also help us, we would be able to reduce the when you qualify for Medicare from 65 to 55. And then the Medicare for all tax would be similar. It would start at 0.5%, and then we can go up to 7.5%. So one of the main points of this is this template of grading taxes and all the way up to $1 billion. I'm not a federal tax budget specialist, so I have no idea if these numbers are correct. I'm pretty certain they're not, but I'm also pretty certain they're pretty close. So I used whatever little research I had and the numbers that I could find to come up with these numbers. But if anyone here knows anyone that's a federal budget specialist, please let me know, and I can help some, get some help tuning this. But this would actually be a better way to pay for it, and it would cover everyone, and it would be the safest way, because the money is coming from one source. This channel, everyone sees this channel, everyone can see the channel on their payroll, on their paycheck. And number 8, make Medicare completely independent of politics. We created a council of physicians and a council of nurses. The council of physicians would deal with medicine. The council of nurses would deal with patients and what's good for the patient. They cannot be overridden. If the council of doctors says this procedure is necessary, then we just do it. If they say this procedure is not necessary, then we don't do it. If they say this procedure is necessary only in these conditions, then that's what it's done. If the council of nurses say patients need this in order to recover faster, we just do that. And these two councils will be able to choose who the HHS director is. And we should add a condition on who the HHS director is. They have to come from the medical industry. They have to have 10 years of physician experience. We actually did have this under Obama for 9 months. I don't know if anybody saw that. Dr. Don Berwick, he was awesome. He made some crazy, awesome changes to make Medicare much more efficient, much more healthy. And he actually came up with some of the preventative healthcare cost savings programs, the ACO programs. He helped to actually implement those programs when he was in charge. But he was only there for 9 months. He was a recess appointment. The Republicans didn't want him. They had to leave. And then we had to choose, Kathleen Sibelius came on after him. So he would have been a much better choice because he was a doctor. And he dealt with patients at every level. Not only was he a doctor, he wasn't just a doctor for the rich. He was a doctor for everyone. He worked all the way down at the county level, at the county hospital, which has to, in Massachusetts, the county hospital has to help everyone. So that's it for, again, you can read the details of all these policies on the website. I'll put the links up right here. And the last one I'm going to talk to you about is affordable housing. So affordable housing has two problems. One, we've overinflated the land prices. And then two, we don't actually have the correct supply. So number one, to fix the land prices, my idea is to create 4 layers of taxes that specifically target speculation. So if you don't do speculation, none of these taxes are going to affect you. Number two, create a public real estate developer and municipal land trust. This real estate developer would have the mission of oversupplying the rental market with high quality affordable housing. When you oversupply, the rent and home prices stay the same. If rent goes up, home prices can come up. If rent goes down, home prices have to come down eventually unless rent goes back up. Because everyone that's trying to go from rent to buying a home bases how much they can pay on how much they pay for rent. So if you oversupply the rental market and keep it down, no one's going to pay all this overflated prices. So they're just going to sit on the market, and all these people are going to be paying taxes on their property. And the second part of their mission would be to refresh decaying neighborhoods without gentrification, or by dramatically dampening the gentrification, so that maybe there'll be a little bit, like 10%, but it's not going to be the 100% that we have. We can create a mechanism where the real estate developer buys up all the decaying houses that are just on sale, drops them to the ground, builds new ones, and helps move people that want to stay in that neighborhood into those new ones, clearing up all the land, and then creating new houses along the way. So I haven't created an article for number 2 yet. That's just something I've just been doing in my head. I have created an article for number 1, and that one we'll talk about right now. So before we talk about affordable housing and the taxes, I want to reiterate the do unto others as you would have to do unto you part. Because if you don't keep that in your head, some of these taxes may seem very harsh, but they're not. The whole point is to stop them from speculating, to stop them from overinflating our land. Speculation is fine when it doesn't affect me. If you're speculating on art, that's not going to change my rent price. But if you're speculating on the land around me, that is going to change my rent price. We need to stop that. That's just usury. They're just extracting wealth through the land. Just all the way back in the Old Testament, God talks about this. Why? Because that's all they had is land. Everything was done through the land. And if you can extract wealth from the land and do usury, you actually end up decaying the society because the entire society becomes ridden with debt every time. And it's debt that it can never pay off. So the whole point of this is to push back on their speculation and their in some cases just dumb buying. Sometimes right now we have people from New York and California coming here, and their housing market is so overinflated. They come here and see our prices, and they're just like, oh my God, it's so cheap. A house there was $500,000, and I can get it for $350. Well, that $350 should be $200 at most, but now you're overinflating it to $350 because you think $500 is too expensive. Well, all you're actually doing is making the prices more expensive for everyone else here. So that's the dumb buying part. There's a layer in there for that too. So the first thing we should talk about is the concept of, well, let's talk about real estate developers and how they're just mostly nonsense. They're just middlemen. Okay, real estate developers just have connections. They want to tell you that the skyscraper that they're building they're just creating value. They're not creating value. If they were creating the value, they could build that skyscraper anywhere and get the same amount of money. They can't. Just like an artist is creating value because they can paint. If they paint in Seguin, Texas versus Dallas, Texas, if they're that good, they're going to get the same amount of money. It doesn't matter where they are. A real estate developer that builds a building is extracting the value that we create. We're the reasons that they can price it that high. They're extracting our wealth. If it wasn't for us, they wouldn't be able to make that much money. So these taxes are basically saying, you are not the most important thing here. The citizens of this city are. The people that want to be part of the fabric of this city, of this society, of this neighborhood. They want to be part of here. Not someone that wants to take advantage of the productivity that we're going on here, that we have here, but someone who wants to be part of this community. So that's the most important part. We're going to lift them up. They're going to get the lowest amount of taxes possible, while everyone else, if they have more than one home, will start getting higher and higher taxes on their property tax. So the first thing we need to talk about is primary residence. Okay, right now, primary residence means you have a home. If you have a house here, you have a house in New York, you have a house in California, you can pick any of those houses to be your primary residence. Obviously, they're going to choose here in order to avoid state taxes in the other states. So right now in California, and in Vancouver, there are companies that you can hire that will make it look like someone lives in your house because they're trying to avoid occupancy taxes and vacancy taxes. So these companies will go in, they'll open the garage, turn on the water, watch some TV, and basically make it look like someone lives in your house. The way we do primary residency is too easily gameable. We need to make a way that they can't game that system and call themselves a primary resident, because we're going to use the word primary resident to mean someone that wants to be part of that city, not someone that just wants to extract money from that city. So how do I say we should do it? Well, taxes. If they pay 80% of their global income tax in city tax, 90% in state, and 95% in federal tax, then they're considered a primary resident. This basically will cover 99% of the people. Here in Texas, we don't have the first two, so we would just use the federal level. But in San Francisco, they have the other two. You can't game that. You can't fake paying the tax. That would be fraud. And you would go to jail for that. So if we make them, basically what we're saying is, look, you're going to either pay these taxes because you're part of this community. People that are part of the community will pay their taxes. If you're not part of the community, then you're going to pay this other tax. One way or another, you're going to pay this because you're either going to be part of the community and we're going to reward you with a lower tax, or you're not going to be part of the community and we're going to punish you with a higher tax because all you're doing is extracting wealth from us. Just because, think about that. Foreign investors come over here and buy up our houses. If you're rich enough to go to another country, to their hottest real estate market, and buy up residents in cash, then you have some money for taxes. And so that's what we're doing right now. Remember, do unto others. We care about the people here, not whoever has money. Do unto others means we put people first before money. People come first, period. I don't care how much profit you can extract. If your extraction of your profit harms society, it's not good extraction. So let's say you don't pay any of your taxes. We're going to call you a foreign investor, right? Even if you do, let's say you pay 90% of your federal tax, we're still going to call you a foreign investor. Why? Because you're not paying your taxes. Pay your taxes and be part of society. Or you're going to pay this. Pick one. Whichever one is fine with you. We don't care. You're going to pay one of these. So if you're a foreign investor, this is for San Francisco, because San Francisco's market is really, really tight. The first home, we're going to tax you at 15% a year on your property value. Second home is 20%. Third home, 30, fourth, 40, fifth, 50. Vancouver actually has something like this. It's not a rated rate, it's just 18% flat. And it's actually helped dramatically put a dampen on the real estate market. It's not going up nearly as fast now, which is perfect. People can actually start to afford rent. Now for Dallas, we don't have a market that's that hot. Dallas and Austin is not as hot as San Francisco or New York. So for us, one, you probably do it 10%. 2 to 3, the second and third homes, we're going to do it 15%. Fourth, fifth, 20%, on and on and on. The whole point is to put resistance against speculation and resistance of rent seeking. Rent Rent seeking through the land is not productive to our economy. We already know this through history over and over and over again. Many revolutions have started because of usury in the land. We have to put an end to that. The land is the land is the land. The land that was here is the land that is here, and is land that's going to be here. It's not going to change unless we destroy it. What matters is how productive we are on the land, not how much we can extract from it. So this takes care of the foreign investors. So that's the first one. So if you're paying, so let's talk about domestic speculators. So let's say you're paying all the taxes, right? Let's say you're in San Francisco and you pay your city and your state and your federal tax correctly. And you have 2 homes. Well, San Francisco's too tight. We can't let you just have 2 homes. Okay, there's not enough space to go around for you to just have your own and to seek rent through it. So what we're going to do is, the first home, you can choose any of those homes. You can take the most expensive of the 2 homes, and we'll call that your primary residence, and you get 0.5% property tax, because in California, the property tax is 0.5%. So the first home you have, 0.5%, we're good. You're part of the community, you pay everything, great. Now, the second home, or see as number of additional homes, +1, you're going to pay +2% on that property. So the second home is going to be 2.5%. The third home is going to be 7.5%. Fourth home, 15%, et cetera, et cetera. Or fourth home, 10%, fifth home, +4, 15%. So this is for the tax table for San Francisco. Their market is too tight. They need to make sure people have places to live and not just extracting wealth. They don't care about how much money you can make on Airbnb. We need people to live here so that they can do all the tech work that does all this revolution and innovation. So let's talk about Dallas and Austin. So here, our market isn't as tight. So maybe if you have 2 homes, we'll say, okay, the second home is cool. We'll give you that home at the same price, 2.4%. Here's 2.4, 2.3. So you're paying your taxes, your first home you get 2.3%. And we'll also say, inside the city of Dallas, the boundaries of these taxes are the city or the county, or however you want to make the boundary. So if you make it the city of Dallas, then you can have an additional home in the city of Dallas, and that's fine. We'll go ahead and give you that. You can rent it out, it's good, we're cool. Because the market here isn't as tight, we have a lot more land, and we're much more spread out. The third home now, we're going to do +2%. So now you're doing 4.4% on that third home. The fourth and fifth homes is +4% or 6.4%, and on and on and on. Again, we're creating resistance to speculation and rent seeking. That's the whole point. I would be so happy if no one ever paid these taxes. A few people may have paid this one, and then no one pays this one. And in Dallas, maybe a few people pay this and no one pays this. That's the whole point. That means there's more supply left because they're not just buying up all the land, all the houses on the supply. So now we come to the house flipper tax. So this is also what I call a dumb buyer tax. So before we talk about this, we have to talk about housing appreciation. Housing appreciates at a default rate. It always has been. From 1929 up until about the 90s, Dr. Dean Baker has a graph that goes like this. Here's inflation, and here's housing appreciation. And it's just right in line. And then 1990 goes up like this. This is when the bubble starts. I couldn't find that graph. It's in a video that I saw. But I did find another graph sort of like it. So in here it says, in the long run, let's see, can y'all read that? In the long run, house prices nationally have followed inflation. And then this is actually a graph of rent prices versus home prices. You can see they're kind of tight, and then all of a sudden they go crazy, like right around the end of the 90s. Unless some fundamental factor has changed, then the run-up since 1997 is a bubble. This slide comes from 2005, and he was right. We had a crash in 2008 because we had a bubble, and he called it. So he has data going back for London from the early 1700s because they had really good documentation. And it's exactly the same. Housing prices appreciate right in line with inflation. The line sits right on top of inflation. It's like 2 points. So let's use that as the GAR, the general appreciation rate. So the general appreciation rate we're going to call inflation plus 2%. So let's talk about this tax table. This is about how much you can go over general appreciation without paying taxes. So if you have a $100,000 home, like let's say you bought a $100,000 home in Uptown in Ross 10 years ago, and you want to sell it now. Right now you can sell that house for like $300,000. It's ridiculous. You don't do anything to the house and all of a sudden it's $300,000. That's nonsense. So with GAR, that $100,000 home in 10 years would be about $125,000. I'm using ballpark math. I don't want to do too precise. So it's $125,000. And we will give you 20% on top of GAR to sell. So if you want to sell your home 10 years later this year, you get $125,000 plus another 20%. So that'll take you up to $150,000. So you can sell your $100,000 home 10 years later for $150,000 and no extra taxes. Now if you go above that, then we're going to start taxing you. So let's say you sold your home for $175,000. $150,000 is a GAR. That's what you're allowed to spend. We won't tax you. So you get the $50,000 from the $100,000 and you're cool. Now you sell for $175,000. That's $25,000 above GAR. What percentage is that above GAR? It's about 20%-ish, 15. So you see here how it is 1 to 3% over GAR, you pay 2%. 4 to 6 points over GAR, 5%. 7, 7, 8, 8, 9, 9. XX, anything over 10 is the same rate. So if it's 20 points above GAR, you're paying 20% in taxes. Crazy, right? I know. The whole point is to create resistance against speculation. That's the entire point. So if you do $175,000, $25,000 is over. Now this tax is actually paid by the buyer and the seller. So the buyer pays, so if you're 1 of 3, the buyer will pay 2% and the seller will pay 2%. The buyer will pay 5% and the seller will pay 5%. Because this buyer is always the one that's going to drive the price up. The seller is just going to take advantage of it. So we need to create a mechanism to create resistance against that. The seller didn't do anything to their house. Why should they be able to take $250,000 of profit? We're the reasons they get paid. They get to sell it that high. So if they get to sell it that high, they should owe us money too. We're the ones that gave you value to that house. So if you're at $175,000, that's $25,000 over, 20 points. So you would pay 20 points, the buyer and seller, on that $25,000, on the part that's over. So $150,000, $25,000 is $175,000. So on that $25,000, the buyer and the seller would pay 20 points on it. So each side would owe like $7,000 on that tax, which is fine. $175,000. I don't think anybody's going to complain that much at that lower rate. So it'll be able to push the price a little higher. Now, let's go to $350,000. What the inflation at price is actually right now. That price is $200,000 over GAR. That's like 200 points. So what would that end up being? You pay 200 points on $200,000 on both sides. Crazy, right? That's the point. They should not be able to go that high. So if they want to go that high, they can pay the taxes. They can pay 200 points on $200,000 or $400,000 on each side, the buyer and the seller. Again, to create resistance against their inflation. Now this doesn't mean that no one will pay these taxes. Just like I said, $175,000, $25,000 over 50, people may pay the extra $7,000, $8,000. No one's going to pay $200,000 extra in taxes. That's the point, to create the resistance against their speculation. So that one is a little trickier. I should make some more charts. And then layer 4, this one doesn't really affect us here in Dallas because we don't have this much of a problem. This is just a little bit of extra resistance for places like London and San Francisco and New York, where on top of the regular home price they pay, right now San Francisco's median home price is like $4 million. Yeah, it's freaking crazy. So if your home is 3x the median home price, or $12 million, between $12 million and 3.5, so between $12 million and $16 million, you pay an extra 0.5%. So instead of paying 0.5%, properties actually pay 1%. If it's between 3.5 and 4, you pay 1% or 1.5%, on and on and on. This is just to create a little bit of resistance. Really, if you in San Francisco, if you had the other layers, this would already push the prices down. So you probably won't need the fourth one until much, much later if the market tightens up again without speculation. And so basically the point of this is cities have the right to structure their tax codes to encourage people who want to be part of the city, not who want to take advantage of the value of the city. Okay, and so yeah, that's it for that part. And then again, we have the public real estate developer municipal land trust, which would oversupply the rental market and refresh decaying neighborhoods without gentrifying them so heavily. And so basically I come back to this. This has to be our foundation. We have to build a planet on top of this. Once we start looking at all our laws based on this, we'll start adjusting them so that they will actually help everyone. Once we start looking at our economy based on this, we'll start adjusting it so that it won't poison everyone. And it'll be a fair economy for everyone. Yeah, so that's what we have to do. So here's the links. Medium.com/@JakeVarghese, that's where I put all my articles. @JakeFlavorful with no A, there's a long story about why that is. If you're a techie, it's kind of hilarious. And then Facebook.com/Society and Purpose. The video that I showed you is on there, and I put all my articles on there so you can share, like, and comment on it. Yeah, that's it. So that's all from me.
So now it's question time. Questions. Also, not only question time, but payment time. So I'll creep around while you're asking questions and collect some loot, please. Anyway, first questioner.
Oh, okay. So I may not have heard all of this because I came in a little late, but can you give some examples in either some small or medium countries or places that have tried this?
We did it
I
here.
know sometimes somebody owns the whole island and maybe they tried this.
Well, we actually, you mean this part?
A lot of the things that you're saying in
Oh.
these cars.
Well, Vancouver's
The parts of
done.
work which haven't.
Yeah, the parts. Well, I don't know. Some of these ideas I haven't seen that many places before, but the foreign investor tax that works pretty well in Vancouver right now, and Toronto, Montreal are picking it up.
We're getting reverberation.
Where's the microphone? Who has the microphone?
Oh, because he's too close to the mic. No.
Well, just turn it off for a moment there. Okay, just turn it off, and it'll stop the feedback there for a moment. Just,
Still green.
well, why don't bring it here?
Yeah, when all fails, unplug, take the batteries out, whatever.
Yeah, that'd be much easier.
Okay, it's those. All right.
Oh, here we go.
There we go.
So what was it?
So what's that?
Yeah, but you had to hit the battery.
There it goes again.
Well, leave it,
Okay.
open the whole thing and.
Let me try a different mic. Something's, we've got some kind of, we'd have to ask the engineer about that. We've got some kind of Hertzian Okay, take the battery out there and let me put it in a different. So strange.
It's the wonder of electronics.
I haven't turned it on yet. I'm gonna cut this down just a little bit here.
Oh, good day.
Okay.
Okay, let me put the bass on.
Tattoo, bravado.
Okay, I hope that's gonna work now.
Where will we do the speakers? Who are the speakers?
Questions?
Did you still have the?
No, I think, did you hear my answer?
Yeah,
My
I mean,
question?
the healthcare part, like many advanced countries do many of those things already. And also for the housing part, Vancouver and parts of Canada, Montreal and Toronto, Vancouver already has a foreign investors tax. And they also have an occupancy, a vacancy tax. That one's easy to gain.
They also have high taxes, is that related to it? Why?
Which one?
Canada. Okay.
I don't
Because of
know.
like, I say because of all,
I mean, if it's that high, why is everyone coming there?
because of the healthcare.
Yeah.
This is not working? Yes, it is. It is. Yeah.
Cool. Yeah, so, and then for the ethics, the Court of Ethics one, I mean, not really, because most other advanced countries have their courts deal with that part correctly. They actually enforce ethics. So that one will be a newer one.
Okay, next question.
Sorry about that, I don't have anything small. Yeah.
With regard to the Code of Ethics, how will the individual IGs be appointed? And what happens as it relates to administrative changes, even though it might be a forced seat per se of government? I mean, who puts them in there? How are they, are they elected? Are they appointed by the president?
Yeah, they should actually, okay, we can kind of look at the article a little bit. There's a selection process that I use to select judges. So basically, right now, the way we select our judges is through
City, county, what
yeah,
have
the
you.
way we don't have, we'll forget about that. Let's talk about the Supreme Court and the federal and the district. Those are all done through a political process. So it starts inside of the system of corruption.
Yeah.
So then they get to choose whoever they want, and then they go through the confirmation, which is usually just theater at that point. And then they just sign them in. So what I was thinking is, okay, we need to separate the selection process out. Well, so what we can do is, the American Bar Association already does ratings for judges. So they judge them based on like legal perceptiveness and jurisprudence and how well they look at precedents and when they actually go over precedents, is it warranted? So they already have scores for everything. So what I was thinking is, what if we took the National Lawyers Guild and separated them into 3 groups: prosecutors, defense lawyers, and public defenders. And so these 3 groups would basically choose amongst the rated candidates of the ABA and then put them up for a vote. And so if they vote on them, then it goes to confirmation. So that way you take out the politics. It's done by professionals that care about, how jurisprudence is delivered. And in this case, the public defenders would actually get a leg up, because defense lawyers defend their clients, prosecutors prosecute whoever they feel like, public defenders defend the public. So their bias is actually what we want. It's their conscience that we want. So basically, in order for a judge to be put up for confirmation, the public defenders have to vote yes on them. So the other 2 can vote no or vote yes, and if the public defender vote no, that doesn't go to confirmation. But if they get the other 2, or all 3 obviously, and then that judge can now go to confirmation. And because Congress doesn't get a say in who they select, they actually have to do their jobs now.
Yeah.
And actually do the confirmation process. And there's a little stipulation here. If Congress rejects 3 candidates from the selection group, then that selection group can seat the very first candidate right into this judgeship as they need to. This is to keep Congress from playing games with the selection process. So they have to choose someone. And this process we've seen, this process is going to be open, so we're going to be able to see who they're choosing, what the ratings are for the judges, what their mindset is, how they did their interviews, and then all the different details and the deliberations that happen from there before it goes up to confirmation. So everyone will be able to see and check to see if this is actually being done in an uncorrupt way or a corrupt way.
No, I understand where you're going, and I think it's the right way. However, the layers below, those even appointed or not, they're supposed to look after a different agency. The way the system is gained right now is that all of the partners within certain agencies or even inter or intra-agency communications conveniently remove themselves from the process. Like, well, I only deal with pink paper, and that is blue. And so therefore, unless that gets straightened out,
that's why all the ethics,
see stuff,
that's why all the ethics is this new branch, so that they don't have to deal with all that crap.
Yeah.
So this new branch, once you set up the court system, well, at the very beginning, we'll probably take the IGs that we have and move them over. And then after that, there will be a selection process for IGs also. That will just basically be the courts doing interviews and selecting IGs.
But those courts would probably have to also set standards at an agency level to remove all the, excuse me, that's not my bailiwick, and I'm not responsible.
Oh, are you talking about the
I'm talking
actual...
about all the nonsense in agencies now, where
Oh,
they
you should-
conveniently show responsibility to someone else's department, and and even though they're in the same agency, they really don't talk to each other.
Okay, are you talking about the responsibilities of their job or the
The
responsibilities of their
responsibility-
ethics?
Both.
Because the responsibility of ethics is different from the responsibility of their job.
Yes, but the responsibilities of the jobs are set up in such a way that they are easily removed from actual
Yes.
accountability.
But
So-
is that ethical?
To me, it's not ethical.
Exactly.
That's what I'm saying. So for this to work very successfully, you have to keep, clean up the garbage
Yeah.
within each
And
agency,
also
so
the-
they don't have excuses for, ethics violations.
Yeah, so once you have an agency that can actually enforce ethics, it'll start removing a lot of those people that do those things.
Yeah.
And so the rest of the people can actually start doing their jobs.
Mm-hmm.
And so just having that is like having the vaccine going into the vein.
Yeah.
So in the beginning, yeah, it'll be a little muddy, and then, we'll have, just like when you're sick and you start getting better, you gotta throw up a lot and you gotta sweat out a lot. So that's what's gonna happen when we first put this in place. There's gonna be a lot of scandals that come out. Because they're looking at everything now. And they can push everyone out, and including Supreme Court justices, presidents, senators, everyone. Everyone is under the direct control or the direct oversight of this ethics office for their ethics.
Mm-hmm.
And the other thing is the IGs we already have really good ethics standards in government. We just need to enforce them. Like doing what you're talking about isn't ethical.
Well, it's not ethical. It also drags processes out.
Exactly.
And people obviously, the John Q. public give up
Yeah.
because
Even the bureaucrats
bureaucratic.
even the bureaucrats start to give up. They start getting cynical, thinking we can't do anything, so I'm just gonna go through the motions.
Precisely.
And so once you remove the corruption that causes that cynicism, because that's what happens. People think they can't do anything because someone's telling them they can't. Why are they telling them they can't help the people? Because there's a corrupted reason for them saying that. So when you remove all the corruption, the people that are just cynical and just kind of zombied out will start being able to do what they came there to do. They can be civil servants. They can serve society. Yeah.
Exactly.
I think you have some very admirable thoughts and ideas. I have a multiplicity of questions to ask.
Sure.
First would be going from the top down. There's a lot of our lawmakers in Congress, and House of Representatives who have passed benefits for themselves that are not available to us in the public. They have made themselves immune, if you will, to the laws they passed for us. So, as a starting point of my question, how would your ethics scenario work to alleviate this problem?
Well, have you looked at the Office of Ethics, Congressional Ethics reports?
Don't have.
Man, they catch a lot of things. They just don't do anything about them. There's a lot of things all those things you were talking about, it's all unethical. We already have rules that say they aren't ethical. We just don't enforce them.
And that is the problem.
Exactly.
So if you're ever ready to run for office, I'll do that.
I had too much fun in my youth. I don't know if I can do that.
I am a independent financial advisor, an insurance agent, and a Medicare specialist.
Okay.
So I agree to a large extent with your thoughts regarding Medicare for all. My thought process is how is that going to be implemented even with a viable ethics committee at play?
I mean, how do we implement Medicare? We already have everything set up to do all this. We just need to do it for everyone. Everything is already there.
Okay. I'll have to rethink my question.
I just wanted to mention that I do think that I do think that some of your sentiments are admirable. I can't say that I agree with how you want to do it.
Okay.
But the thing is, since you did mention do unto others as you'd have others do unto you as the basis of this. Now, we're talking about Medicare. Now, and this, maybe to some people, this is gonna be alien or totally harebrained quackery, but if the medical institutions as they exist now were burying cures and have been for many, like maybe 100 years even, and even though that Medicare allows people to get dished out what they're willing to sell, do you think it's doing unto others as you want them to do unto you, to put unlimited financial resources into the hands of someone who is only going to give you what they can make profit on and will not give you something that may be very inexpensive and very effective?
Profiting over someone's pain is not doing unto others as you would have them do unto you.
Okay, well, I don't think so either. But my question then is, what would you do? I mean, like, I can't conceive someone would want to put unlimited financial power into the hands of people who are actually burying the cures in favor of their own profit.
Yeah, I mean, those top hospitals I was talking about, they're all nonprofit hospitals.
Okay, well, I'm talking about things that they're not going to offer even if they're not profit. I'm talking about things that have been buried that are totally workable and that will never see the light of day if you give omnipotent power to the powers that be in the medical industry.
Well, this isn't giving the powers to the medical industry, this is giving powers to Medicare.
It must, by the way, it must be a question.
Okay.
Really.
Okay, I'm gonna try to frame this as a question. What I can view so far of your three different categories.
Well, there are just three, there's a couple of other ones.
Couple of others, well, let's just go with the three. It appears to me that you believe in hammers because you have created a tax hammer, you created a medical hammer, and as far as the real estate, I mean, I've been working for decades to try to actually own some property, and you're saying once I do, then there's a hammer on top of me and my financial success going forward. So what is your response? Okay, let me frame it this way. In a tyranny, the characteristic of a tyranny is what we call compelled performance. How do your hammers that I'm describing, how do those differ from a free society?
Okay, so should we not have Medicare and Social Security then?
Why do we need them?
There are people there that believe that.
What is the fundamental foundation of why we need them?
Because we should have retirement security and healthcare security.
Should?
Yes, just like we have military security. Why is it that we always spend money and resources on war?
What if I
and not on peace?
What
How's
if
that
I
Christian?
prefer not to? What if I prefer to be outside of that system?
I mean, this is a democracy. I don't like war, but I'm still here.
Okay, anyone else have a question?
Julie has a question.
Up there.
I just by chance listened to a city planner today, this morning, and he was talking about how cities are moving away from single unit dwellings, and in the future they will not have single unit dwellings. We'll be living, like these high rises they're building, and they'll have communal areas.
We'll still have single unit dwelling. It just, what we're doing is we're densifying the center of the cities. So we're making that part dense, but we have a lot of land. We can still have single units outside of the suburbs. Basically, the idea that we had where the suburbs had single units, we didn't think to make the internal part dense. We're just figuring that out. So if we make the internal part dense, that'll be for the younger kids, and when they grow old, and they'll have their fun with their nightlife and all that other stuff. And then when they have kids, they're gonna wanna live there. They're gonna wanna be somewhere where it's quiet and peaceful, and their kids can run around in the streets without getting hit by a car. That's not gonna be in a highly dense area. That's gonna be somewhere else, farther out. I mean, I'm talking about Dallas and our kind of area. If you're in New York, it's a whole different story. They don't have that much land there, and San Francisco is like tiny. But if you look at the entire Bay Area, that's like DFW. So San Jose, Richmond, Berkeley, all those areas, they have single unit homes. So they can have the density inside of San Francisco and on the East Bay of Oakland, and then you can still have single unit homes. But we'll first re-densify the center. And then if everyone's going to be moving to cities like we're having now, then yeah, we're going to need more denser property at the center of the city.
Invalidated my question then. I was wondering where the taxes were gonna come from, but you say there will be single.
Yeah, I mean, even when we have condos, they still pay property taxes. It's just separate. It's just split up. Yeah.
Yeah.
Have you quantified, if you put in place your healthcare plan, what percentage of the GDP would be saved? Have you quantified that? Because right now it's about 17–18%.
And probably
GDP.
that or more. I mean, because HR 676, depending on which study you use and depending on how you quantify it, you could say between $2 billion with a libertarian study or $17 billion, which actually you realize that Medicare has a 2.5% cost instead of 12% cost. And so that could be a dramatic reduction in dramatic savings.
So
How much it
basically,
is? Yeah, I'm not really sure.
so basically, what we see in Europe, you have, instead of being 70% of the GDP, it's probably more like between 8 and 10%. Actually.
Yeah.
That's the typical savings, actually.
You seem to believe in taxes quite a bit as a way of controlling people's behavior.
Yeah, it creates resistance in the marketplace. That's one of the
Well, it
reasons.
certainly does.
Yeah.
It
It also helps equalize society.
Well, that's the theory.
How does that? We have
California is an example of a government that believes in taxes to the utmost. And they are taxing everything to the point that they're taxing cow farts. What prevents your approach from becoming what California is?
What prevents anything from being corrupted?
Well, right. And so your ethics commission is a great idea, but that's already been implemented and it's already been politicized. So it doesn't seem to matter what system you put in place to impose ethics on everybody else, it always gets corrupted by the politics of it.
Well, that's just like a court system. Like, because we have independent courts, it doesn't get as politicized, but it still has some. But we still have some independence there.
Well, but as soon as you get politics in, the only way you can control stuff like that is with a free market where every individual is free to make the deal that they want to make with whoever is selling what they want. And that's the only way you can get rid of corruption. It's the only way.
We've had free markets everywhere.
But are they really free? Are they really free?
Yes, they're free.
I don't think so.
Free
because we have taxes and laws
free
on
or
like
fair.
everything.
I don't care if it's free. I care if it's fair. I don't want to be free to be poisoned.
But you want to impose fairness.
How else do you do that? We impose.
Well, okay, so
we impose laws for murder and rape.
So how do I know your version of fairness matches my version of fairness?
You don't. We all agree on what we consider fair. Murdering is not fair.
Okay, right. But when you impose your
Usury is not
taxes,
fair.
you have a definition of fairness that you're going to force on everybody else.
Actually, my
even people who
definition comes
disagree
from
with
the
you.
scriptures.
Well, I agree with, your initial premise was great. Do unto others as you'd have them do unto you. Except that when you start doing taxes to everybody else, it's your version of what you think those taxes need to be and not everybody else's.
Yeah,
But isn't that always the case?
but I don't want you to do that to me.
What I would urge everybody is to try to keep the level down a little bit and be more gracious than abrasive. And
Here's the point of view.
Yeah.
right, and I do have a question. We right now are medically living under the Rockefeller-Fishbein cartel that came in early in the 20th century. And I would put it to you that, in fact, it is not
That's
a
the
free
pharmaceutical
market.
companies, right?
That's the AMA. That's
Oh,
the
yeah.
AMA. See, I think
Yeah, AMA is
as
actually
an
almost
engineer, you should understand that you have a level of assumptions and presumptions that maybe some of us would question here.
Like what? That they
That's
all
a
rights
free
to-
market. That's never, medical has not been a free market since the Fishbein,
The late 1800s.
yeah.
But wasn't everyone dying?
Wasn't everyone dying?
No.
Not necessarily. There
I mean, if
used
you
to
had
be-
money, obviously, that's the case now too.
There used to be homeopathic cures in the Sears catalog.
So, yeah.
Way back.
We still have that now, don't
Yeah.
we? Yeah.
If you can get around pharmaceutical.
You get it.
Yeah, if you wanted, you can get it. Medicare just started doing that at the scale.
I noticed in your chart there, you were talking about 15% tax on real estate. Are you talking about that per year?
Yes.
Why would anybody build a house if they were facing that kind of tax?
Are they a foreign investor? Why are they building a house without paying their taxes on anything else? That's the whole point.
Well, your definition of a foreign investor is basically someone who buys the property and rents it to someone. But you know, the
No, my
deal is-
definition of a foreign investor is someone that doesn't pay taxes here. That means they're not part of our community. If you're part of here, then you're paying taxes.
got these huge tax rates, and the deal is that if you want more houses.
Only for foreign investors. Here, I'll show you.
Well, suppose he lives locally and he builds a house, but he doesn't live in it, is he then gonna pay these higher tax rates?
If he builds a house and doesn't pay any of his federal taxes or state or city income taxes, then they're a foreign investor.
Well, suppose that a firm from Texas builds an apartment in California, is he a foreign investor?
No, he's a domestic investor, which is a different tax rate.
You're talking about some pretty incredible tax rates there, in a little while you're gonna
Yeah,
discover.
again, the whole point was to create resistance to speculation. That's the entire point.
It would kill the market.
No, it wouldn't. Just like it doesn't here.
It would kill the market.
As a videographer, I find that unless there is a middle class and even an upper middle class, nobody hires me.
Right.
And the people you're calling foreign investors are often my employers.
So they don't pay any taxes at all?
It's just a matter of what you're doing is you're kind of leveling out everything.
No,
near
we're saying
to-
if you pay taxes, if you pay federal taxes in Texas, let's just use Texas. If you pay federal taxes on 95% of your global income, we'll consider you domestic. If you don't, you're foreign.
I'm kind of confused as 95% of my global income. How does that figure out?
You're not rich enough to know that.
See, that's the thing.
That's the actual.
Obviously not.
See, that's the whole point of this part right here.
Obviously, I'm missing that.
You're missing
Let's
the
see if
difference.
someone else has a question.
Well, since you were making, quoting from the Bible on that, I was just kind of wondering, what do you think the difference is between, if your neighbor is sticking his hand in your pocket and grabbing what's in there and calling it a tax, what do you think the difference between that and theft is?
Well, your neighbor isn't a taxing authority, so that's theft.
Since when do you think that since you were quoting from the Bible, and I think it's fair to ask, since you quoted from some kind of authority, since when did the Bible allow anyone to set up a taxing authority?
Render unto Caesar what is
That
Caesar's.
is not what that means.
Yes, it is. It's about his taxes. It's about what he was trying
That
to get.
has nothing to do with paying taxes. I would say it needs more research on your part.
Okay, I'll check it out. I've read the Bible 14 times, Genesis to Revelations.
It had to do with the coinage, I believe, but let's move on. Does anyone else have a question?
I was reading a Texas historian, and she was talking about the mentalities in Texas. And she said the first Europeans coming down that settled in Texas, Nacogdoches area, were rather cultured, sophisticated Europeans. After they were genteel, whatever. Not aggressive, genteel. And then when oil was discovered, all kinds of personalities started showing up that were, they were called wildcatters. They wanted what they wanted, independent, leave me alone attitude. the rich were at that time controlling things, and these other people, less fortunate people, were letting the rich control. And we have that still going on here in Texas. The rich are doing that and manipulating all kinds of things to keep less fortunate people out of the loop. How do you burst through that mentality, that independent, you can't tell me what to do attitude, rather than a cooperative attitude?
I don't know, at some point, like, that starts to harden and you can't actually just break through it. You just have to wait for it to go away. And then the next generation is not gonna do that as hard or as harshly. We can see that public education is a good idea. We can see that roads and Social Security and Medicare were good ideas. This is when we try to do unto others as we would have them do unto us. We are giving everyone all these other opportunities. So when they stop seeing that as opportunities, then really we should just take the power from them. Like what we're doing now, last election, we just flipped like 10 Senate seats, or 10 House seats, or 10 Texas Assembly seats, and we flipped Pete Sessions to Colin Albright. Because I was part of that movement that's trying to get more younger people into office that don't think like the past does. They're trying to go forward instead. We don't want to get stuck in, we don't want to be another, we don't want to be another oil state. We can do other things. We can diversify our economy. We can be biotech. We can be like Silicon Valley if we recognize that we need the education part. That's why Silicon Valley is so good. They have 2 world-class research universities and 2 world-class research labs right there. That's what makes Silicon Valley Silicon Valley. No one ever stopped to ask, who is training all these innovators that we're investing in? They're not pre-endowed with the knowledge. So if we have the correct educational system and the correct system that allows everyone to get that education, just like we did even before I went to school, at one point, UT was free. I know all the California schools were free at one point. When I got there, it was $5,000 a semester. Now it's $15,000 a semester. That's like a private school. This is just going to allow the rich to get more education and the poor will just be left behind. So we need to fix that part. And yeah, that part, that high individualism type mentality, it just needs to go away. That's it. We're probably not going to be able to break through all of them. Some of them we can probably break through.
It's sort of like, don't see a value in cooperating.
Yeah, that's.
When you have that independence.
They're not paying attention.
You're not seeing any value in cooperation. It's a defensive stance.
And then they try to build teams up around their oil. So they're trying to get people to cooperate with them, but they don't want to cooperate with society. You know, they didn't build those roads. They didn't educate those workers. We did that.
I've in the last couple of years in Dallas, I've noticed that this place is really turning into California, really, with congestion and everything else.
I've never seen so many California license plates. I grew up here. I've never seen that many California license
And what's your opinion about this social move that's happening? I mean, who's making the money, and because it's actually kind of destroying the place. Actually.
Yeah, whoever had the money is making the money because they already had the money to buy up the land cheap. They already had that problem. Then all the people are coming from California because that land is too expensive now. They can't live there. They're trying to come here because it's cheaper, but they're making this place more expensive.
You made a comment about those who are basically unethical and in a lot of power. We're just going to have to stand back and let them diminish. That will never.
No, not if they have power. I'm talking about if they're unethical and they're just like, well, I guess if they have an oil company, they have some power.
Yeah, they've got a lot of money.
Yeah.
Money rules this planet.
And again, money in politics is something I wanted to talk about. But
you cannot have a war without the government being supported by its banking system.
Yep.
The same banking system supports both sides of every war there is. It's evil.
Mm-hmm.
Now, interestingly, you put up the golden rule, do unto others as you would have them do unto you. Do you know that is actually preceded by thousands of years from ancient Egypt? Do unto others as they would have you do unto them, which I think is a much higher concept. But anyway, They had a kingdom they had a civilization that lasted for 5,000 years because they had laws that were things like always speak the truth to everyone. You didn't do that, you violated the law. Always treat everyone in a kindly manner. Now, if we went ahead and enacted laws against these liars that we have, like in Congress, I mean, you can see them all over the place on the news. If we also decided that things like all of the tremendous wealth in petroleum under the ground is really the right of all mankind to have, and do like Gaddafi did and confiscate that oil industry so that it fed the nation, paid all those things that taxes would pay.
We can't do that right now. Every time a country tries to do that, they get invaded by us.
Yeah. It's the evil that
Except
is
for
in
Norway.
control.
Norway didn't get invaded for some reason.
It's the evil that is in control. And we need to recognize that. We have antitrust laws in this country that are no longer being enforced.
Yep.
Now, what can we do as a people to see that those laws are enforced, to see that these cartels, like petroleum, like the medical industry, are broken into 1,000 pieces? What can we do to accomplish that? Because we'll never have freedom without that.
Yeah, for me, it's getting rid of whoever's in power because they're the ones doing it. They're the unethical ones. And this is a paradox of the ethical living with the unethical. The unethical will always keep the ethical up to their ethical standards while never ever being held to that standard. They will always tell the ethical, you need to be ethical. But they will never behave ethically. So we need to actually stop being polite with the unethical and just start enforcing the freaking laws. Because right now, money controls everything. The reason all these politicians do that is because A, they like it and they like the money, or B, they're so terrified of the money they don't know what else to do. Because here's how it works as lobbying. Either you like whatever's happening, who cares about that scenario? Let's say you don't like it. Well, then a lobbyist is going to come up to you and go, hey, if you don't vote for this, I'm going to give $100,000 to whoever your opponent is in the primary and push you out. So now they got to figure out, okay, do I want to keep this job or do I want to keep my conscience? And we've made a system where it's very difficult to hold on to your conscience. And it's very easy to find money if you don't have a conscience. So money in politics really is probably one of the core things. Plus, we have to freaking fix the media and make it inform us accurately.
Do you suppose that the Silicon Valley, the paradise on earth, is controlled by the rich?
It is now.
Yeah.
Yeah.
Just like everything else.
Yep.
It's controlled by the rich. Do you think, Texas is such an evil place? We oppress people and we do this and that and what have you, and then the rich control it. Why do you suppose people are fighting to get here?
Because it's cheaper than California.
Why do you think that is?
Because the unethical have made the land in California ridiculously overpriced. That's been happening for like 60 years. The inflation that we have now comes from California 70 years ago. Prop 13 is because of that speculation. Prop 13 didn't actually solve the problem. It solved that person's problem of paying more taxes. It didn't solve the problem of speculation. And then we exported that to the rest of the country. Then we exported it to the world. And then Europe blew up in 2010.
One last question. If you run all the unethical people out, where are the new ethical people going to come from?
Oh, I guess you're presuming everyone is unethical then.
We're getting, like we said, the human heart is desperately deceitful above all things. So that's all.
Yeah, but I mean, just like we have laws against murder and rape, we can have laws against usury and corruption.
How do we determine what's a fair tax to tax people?
For me, like let's say we're talking about the income tax, right? So we don't know how to grade it correctly. We actually can look at the savings rates and see where the curve drops off. And that's where we would actually put the brake. So right now, we have no savings rate in this country. It's like from 0 to 90% percentile, it's -10. Everyone's just in debt. And then it goes up a little bit at around the midway point, and then about $150,000, it comes up to about 10%. We're at $300,000, and people can save 20%, or maybe $400,000. And then above that, it just goes higher and higher and higher. So where we see that break in savings is where we can actually put the break in the tax rate. So people that, basically most of the middle class would have a very low income tax rate. We could just have payroll taxes that pay for all the major stuff, like healthcare, social security, education, infrastructure. And
We
then
have all these other taxes on just about everything.
we have sales tax.
Yeah.
Were you aware that in the former Soviet Union, at least in Russia, they never had anything over a 10% tax?
Okay.
I'm just saying, are you aware of that?
No, I wasn't.
Are you in favor of supporting our Constitution?
Yes.
Then why are you in favor of income tax? It's totally unconstitutional
Why do
and
we still have
illegal
it?
from the day it was conceived.
Why do we still have it?
Yes, because we have a bunch of idiots in this country who go along with the power of these people. People don't stand up.
Okay, so how do we pay for it? I mean, if you want to get rid of income taxes, that'd be kind of cool, because then we can get rid of wars, because that's how we pay for them. And that's kind of like the best shining example of that scenario for me.
All right.
Income tax only pays the national debt on the usury money from the Federal Reserve System. Before income tax, the Treasury printed the money, all it needed, and no interest rate on it at all. Other taxes pay all of the government's expenses,
Oh.
not income tax.
Okay, so your complaint is that income tax isn't necessary for paying, for doing the business of the country.
That's correct.
You
That
can
is
just-
correct.
Yes, we
That's
can
correct.
just print money and pay for everything.
No, listen to me. The Federal Reserve prints money
I know.
to any amount they want.
Mhm.
They printed enough to have 250,000 Al-Qaeda paid, armed, go in and wipe out Libya, for instance. That was the
We paid
banking
$27
system.
trillion to banks over the last 10 years. That didn't go up on our debt.
Pardon me?
We paid $27 trillion in quantitative easing to banks over the last 10 years. That's not on our debt.
Well,
That's banker business.
Yeah.
what I'm
And
saying
yeah,
is
you're
that
right. We could do that. We could just say, here, you know, this agency, you get that money, and just give it to them.
the Constitution was set up by founding fathers who were a hell of a lot smarter than I think almost anybody in this room is. They knew what the private banking system was.
Mhm.
And Thomas Jefferson stated, if we ever let a private bank get control of our money through inflation and deflation and the corporate structure that will grow up around it, they will steal all the property from our citizens and leave them homeless in the land they have founded. They were smarter than these people running the country today.
Oh, that I have no doubt about.
So why would you not want to follow the Constitution and get rid of that private banking system? It's evil.
Well, it's evil because we let it do whatever we want to.
It's evil because it's unconstitutional. Its very existence.
Then why hasn't it been challenged?
But it
Well, there are people who...
It has been challenged.
And
Went to
then
jail.
Supreme Court
So you have
said
a system fighting it. As a payment for the government, the income tax was not created until 1862. And it wasn't really implemented in any great extent until the 20s. Okay? During the 1800s, import tariffs and excise taxes paid for the government, and there was a surplus. I remember seeing political cartoons where there was an octopus labeled budget surplus, and politicians were knocked on for taking that budget surplus and spending it in all kinds of unethical ways. Same thing they're doing now with the deficit spending, but there was plenty of money around because we didn't have an income tax. And the government was getting plenty of money from excise taxes and import tariffs and such stuff. So why do we need an income tax, especially when the Constitution says any direct tax shall be apportioned? And that means it has to be, the federal government has to tell the states, we want this much money, and it's up to the states to get it. The direct income tax is completely unconstitutional. So your response?
Okay, I think he confused that a little bit,
I think the
but
Supreme Court has already said it's constitutional, so.
No, not the direct income. No, not the way it's
the direct
implemented now.
capitation tax, he just confused in his last statement there. Everything else is okay. Okay, one more question here. You are saying people who want to be a part of the city pay their taxes.
People
I
want to
have-
be part of that society.
Okay, that part of that society. I have a fundamental difference of opinion. I don't believe in polar vortexes. I believe we're in a modern minimum. I believe we're going into global cooling and not global warming. My city council is voting carbon taxes, which are paid to the 1% of the 1%. That's my tax money being spent by Dallas City Council to have carbon offsets.
Wait, is it your money or the other company's money? Because one company is getting taxed and giving it to the other company.
So is Dallas City Council, is Dallas County not purchasing carbon offsets? Are they or are they not? They say they are.
Oh, that I have not heard about.
Oh, I have.
Okay, I'll check that out. But
Okay.
so how does this carbon tax work? So are they participating in a larger carbon tax conglomerate, or are we having our own carbon tax system?
They are going ahead with Agenda 21 in violation. We've never signed any treaty on it. They're just going ahead being progressive and going ahead and basically paying our tax money for carbon offsets, which I feel is completely fraudulent. So
Okay, so who are we paying the money to?
that would be providers of carbon offsets. Are you familiar with that whole little sub-economy they're trying to?
Yeah, from what I understand, so like a plant pollutes, has carbon in the atmosphere.
Which they should clean
They
up.
get taxed, and then if somebody else doesn't pollute, well, actually, they get taxed and they can buy credits so that they don't have to pay the tax. From what I
They
understand.
buy carbon offsets.
Yeah, offset credit,
They
yeah.
buy units of carbon
Yeah.
offset for their pollution instead of cleaning up their act.
Yeah. Oh, I would like it if we could do the cleaning up part better. But I think that like as from an engineering standpoint, you have to put the Band-Aid in first before you can start on the real hard part.
Okay, but my fundamental question here has to do with the foundation you're talking about. And I am still questioning you and probing that you're making a lot more assumptions than I'm willing to make.
Okay, from the carbon tax?
What are we missing? We're missing oxygen. We're not, what is a carbon dioxide problem? Describe that to me.
It's not a problem.
You mean toxic?
CO2.
Toxic gases everywhere?
CO2 is not toxic.
It's not just carbon dioxide, it's also carbon monoxide.
CO3 is the
Okay, that's, CO2 is the big noise. That's what everybody's talking about.
CO actually.
It's plant food.
Okay, I think, any more questions? Because we have to have time for our 5-minute rebuttals. So, the first person is, would like to get up and say a few words, 5 minutes.
So do I stand here or go there?
Yes,
You can sit down now.
Or you can sit,
So-
rest your legs. And
Oh, yeah.
Yeah.
listen.
Do you have a place? Do you have a place to sit?
No, I just stand right here.
Oh,
I've
well,
already had a seat, actually.
that could, it could be 20 minutes and we gotta find a seat or something.
Yeah, this will be a dissertation, not a cross-examination. Well, I agree with your statement, doing to others as you would have them doing to you. And that is a good thing to live by. And unfortunately, we are a flawed race, and seem to be getting more flawed every day. But you know, the problem is when you give power to government, power corrupts. And when you throw the rascals out, you bring in a new set, and they're soon corrupted by power. I don't think you can go to Congress without being corrupted. You know, you're immediately beset by lobbyists and people that are working, doing their very best to corrupt you to get what they want out of government. And the answer to that is less government, not more. I think that if you have Medicare for all, universal health care, what you're going to wind up with is pretty much what you see at Parkland Hospital. If you like your doctor, well, that's tough. You know, you're going to take the next one in line, and it's going to be a long line. The VA is the same way. It's run totally by government. And from what I hear of other countries' healthcare systems, they ration healthcare by just making you wait. I have a cousin whose husband worked for Ford. They were stationed, he worked for them up in Canada where they made the Crown Victorias. And I said, how do you like Canadian health care? She said, it's great if there's nothing wrong with you. If you've got a cold or a cut finger or something like that, you walk into one of these clinics, they fix you right up. But if you've got something serious, if you need an operation or something like that, they put you on a list. And most of the people she knew, if they had something like that happen, went to the United States to get the health care because you can't buy it in Canada. You know, you're forbidden by law to pay extra to the doctor to see you sooner to get you out of the line. And she was fortunate in that they had Ford Health Care, which covered their cost in the United States if they needed it, or they had the Canadian pass for health care up there. But I don't see universal health care as being an answer. California would do that in a heartbeat, but they looked at it and they realized they can't afford it. Maine or New Hampshire, one of those two, wanted to do universal health care. And they also have looked at it and they realize they can't afford it. You know, it's not a savings proposition.
Right.
It could be, but it's not. You know, there's no point in letting government do that. What we need is more competition in health care. We need transparency in what the billing is and that sort of thing. And what's being talked about is not addressing that. But I'll get to real estate. I own about 8 rental units here in Dallas. Since I bought them 3 or 4 years ago, my tax assessment has increased by probably 50–60%. But I gross about $100,000 a year on those rental units. And it's probably $1 million worth of property. If you had to finance that at 6%, which is kind of the going rate for commercial property, that would be $60,000 a year taken out of that. The insurance is another $5–10,000 a year. The taxes are about $30,000 a year. That's just the property tax, around $30,000 a year. And the deal is that the city and the government units are taking a whole lot more of my rental income than I'm getting at the end of the day. And the consequence of that is that I'm not buying rental property anymore. You know, nobody's going to build rental property anymore. If you want to increase the housing stocks, you have to give people an incentive to do that. If you just say, well, you get it, we're going to take everything you got in taxes, they're going to quit building it. The other is, or they're going to start adding that cost into the rent, and that's why rents are skyrocketing. It's not part of it is the demand is there. The other part of it is that taxes are going up. You know, when you tax people, somewhere that goes somewhere. When you tax the rich, what they do is they just say how much you want, and then they put it in the price of what they sell, because they provide goods and services. Unlike the government provides some goods and services, a lot of it is just waste and fluff. The other is that, you know, when you talk about, well, we're going to have a tax rate that only taxes the very rich, what you have there is that you have a fixed percentage taken out of the income for Medicare and Social Security. That's not a graduated tax. Income tax is a graduated tax. And I guess last but not least is that some of us enjoy freedom. We like to be able to decide where we live and where we work and what we do. If you let government control everything, it's basically slavery. They tell you what you do, where you work, who you go to see for the doctor, or if you get to go to see the doctor. And I don't think that that's what this country is built on. And as I mentioned earlier, you know, we're just terrible. If you read the newspaper, we're terrible in Texas. And the deal is that terrible as we are, people are moving here, trying to get here, to share in that unfortunate situation we have here. In the paradise over on the West Coast, people are leaving.
Yeah.
So, you know, you have to wonder whether that's really a good prescription or not. Thank you.
I would remark that anytime you try to bring heaven on earth you've got somewhat of a misconception going there. Is we have a very imperfect world, and there are two different approaches. You can try to bring utopia here, or you can pragmatically, logically, rationally try to do the best with the situation you have. And what we call conservatism today used to be called classical liberalism, and it seems we're always swapping terms here, and it's very difficult. When I remarked about hammers and so forth, I would say that what you would be creating in each of those categories, whether it's judicial, ethical, or real estate or health, is you're creating a very hefty hammer to hammer people with, almost kind of on the scale of the French Revolution in some ways. And I believe it is abrogation of individual rights, which brings the issue down. I hear a lot of words about society, but as someone said, I don't remember which movie it was, but the greatest good is that each one be free. I don't know if that was Mel Gibson and Braveheart or where that was, but it really, individual liberty is what the Constitution was set up to protect. And once you start giving any agency or elements, actors within government, the kind of power you're talking about, I would just direct back to the Constitution, where we have separation of powers for a very good reason. And it's that no element of government has so much power that they become the dictator. Right now we're in a very dangerous situation where we do have, I would say, too much power in the executive branch. And I think that many on the other side of the equation might agree that there's too much power there, but you hope you get your own person in there, and then you can take off from there. I'd say we really need to eliminate executive orders. They were never intended to be used the way they're being used now. If you really want to fix matters, this is kind of like, okay, how do we get ethical government? Well, government has not been ethical for so many decades or century or whatever. I mean, this is a real problem, because I've talked to insiders and they affirm that above a certain level in government, they say anyone in an important position in government is compromised. They have a file, somebody holds their file, and either they do what they're told to do at a certain level, then they don't survive, they don't get elected back in, or in some cases, in fact, if you will recall, Paul Wellstone was wanting to open up an investigation, a new investigation into September 11th. Paul Wellstone, he and his entire family died in a plane crash, and when people started bringing up things, the echo in Congress was, well, you don't want to be Wellstoned.
Yeah.
This statement, do unto others as you would have them do unto you, is a cooperative attitude. People cooperate with each other. People care about each other. This is caring. Care for others because you would want them to care for you. And if it's, the Constitution does not say me, the individual, it says we, the people. And
That's
it's,
the Declaration.
well, it's for the good of all. And we're not gonna get individually everything we want. That's not gonna happen. We're not gonna get that in any place in the world. And we have more freedom than most places in the world. So I just, would like for us to remember that it is a common good for all, and it's a caring rather than defensive attitude. If you say, you're not gonna tell me what I can do, and I'm not talking about, I'm talking about when I said the oil people came here, well, these people like a Jonah, bigamist, heavy gambler, all kinds of alcohol and whatever, those are the independent people I was talking about, not less fortunate people, and some of us. That's the rowdy attitude. Those are the people with the rowdy attitudes, and promote this independence in Texas rather than cooperation. And I believe that the defensive attitude is a fear-based attitude. How do we eliminate basic fears in people? We see that their basic needs for existence are met. And that includes education, healthcare, shelter, food, etc. And so these are the basics, in my mind, of what our country is about.
I'm always kind of amazed when I hear this, freedom and democracy.
Rugged individual.
And rugged individualism, yes. It's all very well for the well-heeled sort of middle class to promote this kind of thing, because what about the waitresses that have to live on the standard wage of $2.13 an hour, for example, and the people that are maids and have to rush from one job to another, and it works out they're probably earning way under $7 an hour. Okay, so freedom, I'm afraid, it only happens when you have enough money that you can buy your way around this world. The majority, well, a good majority of Americans, I'd say, don't have that kind of freedom. We know for a fact that 40% of Americans don't have $1,000 in the bank. So, your freedom and your, ability to do things is severely constrained when you're at that level of poverty. In fact, I think the Oxfam has just produced the information that 27 people, individual people, own half of the world's wealth. Okay, half of it. And they pull the strings. So to think you've got freedom of action is really a chimera. These guys at the top are pulling the strings. As we know, you send people to the Congress, and immediately they're compromised. What sort of freedom do you really think you have? When as our friend said, everything is corrupt. Because these people might have ethical standards, when they're a baby in the womb and whatnot. But once they get out there in the wide world of commerce and whatnot,
They make it out of the womb.
and I'm afraid that all that ethical stuff goes out the window. And I'm afraid to say, from what I've seen, the way the world works is ripping someone off is seen as a fine thing to do and a very commendable thing to do these days. Ethics, I'm afraid, is very, very hard to find. And anyway, a word to Mac up there. I'm afraid, Mac, you got into real estate too late. I got into it 35 years ago, and yes, it's tough at the beginning, but so I'm happy about that. But yeah, but you see what has happened actually, and I went down to the appraisal board and I said, look, there's a rap going on here. You know, you're telling me this property that, you know, has gone up by this much, and I said, look, this is all speculation coming from California, and you're feeding it by coming up with these completely stupid, you know. I said, look, a property, you know, you can value it by, you know, what people can pay for it, and the population, their salaries have not gone up commensurate with all these ridiculous prices, you know, and that's what you see, and so what's happening, as we've all agreed. You know, I see it, we're turning Dallas and this area into a California. No one can afford to live here after a while. They certainly, not the lowest paid people certainly can't. And I see huge stress in families. And when you're under this, and really it's affecting healthcare. God, I mean, you know, one of the problems is, this is why people are turning to opioids and goodness knows what. Because, you know, they just give up on things. They can't make it. And you talk about having ethical values. Well, I'd like to see it. I mean, I would really like to see it. You know, I try to behave ethically and give people a fair deal, and perhaps more than a fair deal very often, because I can afford to do it these days. But you know, I don't see it being I don't see people treating me ethically. I just don't. But you know, because you know, when I realised back growing up in London that was bombed to pieces, I mean, we had nothing. So we valued every tiny thing we had. But these people, they have everything, they don't value it. And of course, most cases they can't have it because they can't afford it. And so the thing, you know, the society has gone off track actually, I think. And yes, we do need more ethics and honesty in this world. But you see this system that the founding fathers set in place. You know, they went back 300 years or when they found it, they went back 100 years in British history, and decided they wanted a king by election, and his acolytes were his cabinet. You pick guys off the street with no discernible value to run up these cabinets of state. So you know, it's just. And of course, as we know, with the K Street mob, I mean, they actually write the legislation, and as you say, they just bribe the senators and the House to pass it, or else you don't get funding. You know, it's tailor-made for corruption, this system. Well, because we're in the country is in continuous electioneering. You know. Well, you know, it goes on and on. In England, you know, like a general election. 5 weeks, 4 weeks at most. You just can't spend it. The bribery, it can't be, don't have that leverage. Anyway, I've spoken enough, so.
Calvin, who we watch the wires.
I'm trying to get it straight to it.
We just pulled a cup over there.
Okay, thank you for your presentation. My problem is how you implement it. You know, we are in a system that's not perfect, and it has a lot of problems. We are not a revolutionary nation. We don't hardly ever do anything revolutionary. It's evolution. And to get what you want, it has to be a revolution. And the support is not for it. I'm for, and I made a report some time ago about Medicare for all. Medicare has a pretty good system, and it's been interested in all parts of the healthcare system, respects it. I think we should have it. I think if everybody was in the healthcare plan, the rates wouldn't go up so right. The reason they go up in the Affordable Health Care Act is they group everybody that's in that plan together, and they are old and sick. And when you have that kind of situation, the premium rate is going to go up. And one of the problems we have is we don't have it right now. Totally. I'm not talking so you can hear me.
No, you can have your hands on the keyboard. It's typing for you.
Oh. Thank you, thank you. The Medicare program has been interesting. I worked for the Medicare program in 1970 to 1972. They made a lot of changes since I left, and I tried to keep up with them, but they made a lot of changes. But they do have a good system. The problem is, how do you bring everybody else in that's not in it? You can say children can be under the parents' insurance till they're 26. But then once they get out of there, they got to get in something for themselves. So I think we can negotiate prescription rates, and we should. And we would save a lot of money to individuals by doing that. So I agree with that part of it. Medicare covers home health care.
Oh yeah, they started doing that.
They cover home health care. So that's one of the things that happen. Number 3. Number 2, adding mental health, preventive health. We really need to have a stronger preventive health care program. We had, and even people who demographically would be high blood pressure or diabetes and stuff like that, you can manage it. But one of the biggest problems is people are so stressed out, and anxiety is going to push it up. But I don't know how we deal with that. But we do need to have, there are some elements in affordable health care dealing with preventive health care, but it's not enough. The 4th point you have, nutrition and stuff like that ought to be a part of public health. So I don't have no problem with that. Medicare. When Clinton was president and Hillary was over the effort to enact national health insurance, they underestimated the power of the American Hospital Association.
Oh yeah.
And you can't, some of these things is not going to happen. I tend to be a practical. What's possible with the attitudes of people. To change people's attitude takes a great deal of effort, and that's not going to happen quick. The other problem we have is everybody have greed. We want not to do other than others. We want to do others before they do us. We've got to get beyond that. And you know, poor people have greed. All up the social status, there are more the more greed you have. So I don't know. I wish we could have ethics. The state legislature, Texas ethics, is basically nothing. The city of Dallas, I served on that for about 9 years. You know, they dealt with conflict of interest, nepotism, and those kinds of things.
Did they do anything about that?
Yeah, we did something about it when we caught people who were really guilty. Most people weren't guilty of it. It's much stronger than the state, and probably the federal one too in Congress. I just think that to implement some of the things you talk about, it's not going to happen. Medicare, Medicare, they deals a little bit with financing the hospital. The health insurance company pay the claims.
Oh, for Medicare Advantage?
For all of Medicare.
Oh, really?
Yeah, they pay all the hospital claims, all the physician claims. Medicare has contracts with Blue Cross Blue Shield, Aetna, Equitable, and all those insurance companies. They pay the claims on behalf of Medicare.
Wasn't that recent with Medicare Advantage? We allowed them to do that before that?
No. They've been paying it from the beginning.
Really?
Yes. I was there, I know. Medicare had one little small unit that dealt with some, but it wasn't the Advantage program. Its coverage is paid by the same people. You got insurance companies are paying the claims. We limit the administrative costs, and that's how we kind of control that, how Medicare kind of controls it. So those are some of the things you got to look at is how are we going to bring everybody else into the program? And I didn't see that in it. So those are the things you got to look at is I believe we need to have Medicare for all. We got it for a majority of people anyway. We could expand it and build a way, and I made a presentation about how I thought we could do it. And some time ago, your decision there was different. The housing situation, the thing what people need is they need to have a job that you can make a living from. And that's where we got to start anything. We got to have People gotta be trained, they gotta be educated, to have a skill or a trade. And until we deal with that, we can't deal with it, because if you don't have a skill or trade or profession that's needed, you're gonna be marginal. And that's where we gotta start with. We got housing. Housing is expensive to people who live in Dallas now. I paid $25,000 for my house in 1970. I'm still in it. It's 1,600 square feet of living space. It's 22,000 with a double car garage. It's brick veneer. It's better now than it was when I bought it. It cost me $200,000.
Oh, did you sell it?
You know, if I sell it, they won't pay me less than the market rate. So the average house in Dallas is $250,000.
Yeah.
And you can't pay that on, if you may earn $100,000, you can't do it.
Yeah, the median wage is like 4x away.
Yeah, so I don't know what's going to happen to people buy houses now with the income, but that's where you got to deal for to deal with the housing problem. You can regulate it. I believe in regulation, more regulation than we have right now, but I don't think the government need to run the hospitals. They're doing, we can deal with, regulate, and see, ensure that they do the right thing.
Right.
And that's what Medicare primarily does. So that's my take on it. It's noble. I don't think it's practical with the attitudes that we have in the United States. Thank you.
5 minutes, my dear.
We'll do our best, dear. I'm really glad that you mentioned the Cleveland Clinic and the Mayo Clinic and the like. And the systems that they have set in place absolutely should be the standards that all hospitals operate under. For example, and recently on PBS they did, and if you can pull it up, you should watch, there was a fantastic documentary on the beginnings of the Mayo Clinic forward. It is absolutely fascinating, the things that particular institution in and of itself, pioneered long before other, and then it became a teaching hospital and so on and so forth. And to give you an example of not only, yes, they do pay salaried, doctors, nurses, everyone is salaried, but they also make incredibly ethical decisions as it relates to overall patient care, and they couldn't believe what insurance companies were trying to do with a simple thing like radiation, regular radiation, and then proton radiation came along, proton therapy, and they couldn't believe that insurance companies wouldn't pay for that. They said, oh, well, that's just new, unexplored technology or what have you. So they made a conscious decision that they would not charge any more for proton therapy than they did proton beam therapy than they would for regular radiation, and they just absorbed the cost of the equipment that it took to do this. And those are the kinds of ethical standards that everyone, whether you live here or anywhere else in the world, should be looking for. Okay? As it relates to freedom of choice, anyone that thinks they have freedom of choice as it relates to medical care in this country, just throw yourself back to even before the Affordable Health Care Act, which could have gone further, okay, if everyone had not tried to boo-hoo it at town hall meetings. Funny enough, those same people are now showing up and telling their Republican reps that they absolutely want to make sure that pre-existing conditions are covered, but they were booing it years previous. Prior to the Affordable Health Care Act in this country, 10,000 people died every year from preventable disease because they did not have access to health care. And it was easily curable situation. Could be diabetes, could be blood pressure, whatever. And so if someone doesn't seem to think that you need to put your arms around that and put forth a system that delivers quality of care of some sort. If you want to have private insurance or go to very, specialists, you can do that, buy a supplemental package. But it should be a decent and expected right of being a citizen in any country, that you're not going to die on the street somewhere because you weren't able to get to a doctor, or that the fact that protection is given to pharmaceutical companies. Even recently, kids from going over the border in Mexico, because the insulin that they would be charged $1,400 a month here for costs $140 or $104 in Mexico to buy. If everyone thinks that we should have this freedom of choice, then have at it. But I'm sorry, I've lived under two national health plans, one in England and one in Germany. Okay, the gynecologist I went to see in Germany, in Heidelberg, also lectured at the University of Heidelberg. So you're not getting the bottom of the barrel in care. We were on vacation in England and I thought I was coming down with the flu. The place we were staying, well, let me call the doctor. Called the doctor's office. The nurse said, well, come on in, to the surgery. I said, well, I'll hold for a day. How much for cost? Nothing. Just come on in. And I wasn't even a citizen of that country. Okay, so these are not things that an average citizen should have to even discuss, whether or not it's available, whether or not we should have schools. Okay, taxes are taxes. How do you think the roads get there? Okay, and it's not okay to leave it up to the free market system, because quite frankly, in the late 90s, the fact that the chairman of the United Healthcare Plan, and they hadn't even really taken off to the abuse that they have since, heaped on the public, that guy in the late 90s is retiring with $1 billion pension plan. That's obscene. If you want to rave on about how wonderful that free marketplace is beneficial to society, I have to disagree with you. Okay, and taxes are due, they're payable, they organize society. Do people pay more taxes in Europe and Scandinavia because they have certain plans, in place? Yes, they do. But their quality of life is much higher. Poverty is not seen. When you walk the streets there, people, as a rule, are not homeless. And everyone is taken care of. Kids are educated and well fed in schools. The quality of the food is far superior because we've allowed corporate farming to pollute our food supply. And just the last thing I leave you with is that even this past week, and this deals not only with taxes, but the obscenity of the oligarchy that we have permitted to present itself, given most of the cabinet people that surround this current administration come directly from the sectors of the industries that they're supposed to oversee. So ethical standards absolutely need to be in place. But just this past week alone, there was a woman in New York City, and she walked down the subway with her baby carriage. And, it's a very dilapidated, 100 plus, 150-year-old system. She was going down the stairs, yes. And all the stairs were worn, and she fell. And she died. Okay? Luckily, the pram with the baby therein survived. She was dead. Just a few blocks away from that, a hedge fund manager, bought the most expensive home ever in this country. He paid $238 million for a penthouse in one of the buildings. Now, if you think that that's just a fantastic way, and boy, we're all going to jump on that bandwagon, one, you're delusional, but two, it is so obscene and so common, and that even the homes that are being purchased here in Dallas, which are driving up property taxes, a lot of them are being bought for cash, because a lot of the purchasers either have got lots of profits from the West Coast property they sold, and they have to reinvest it. I understand that. But a lot of them, because I know people in real estate, are young. And they're like, these trust fund kids that are just being able to come in and do this. So it's wrong. Government is important. Taxes are very important. And basic services such as health, education, infrastructure and the like, it shouldn't even be a point of discussion for anyone. That's my view, and I think you did a great job.
Okay.
Jake, you got a chance to rebut. At the end.
At the end.
I'll just remind you.
Okay, yeah. Several years ago, I testified before both houses of the Texas legislature with regard to the abuses of Texas Medical Board, or shall I say the tyranny of the Texas Medical Board, enforcing something called standard of care. They were tyrannizing Texas doctors for prescribing anything more than this thing called the standard of care. If a doctor prescribed you to take vitamin C and that wasn't the recommended standard of care, that doctor could receive a complaint. 2 or 3 complaints, they can lose their license, their medical insurance of their practice can go way up. There was nepotism in the Texas Medical Board, there was favoritism, there were doctors who lost their licenses, that members of the Texas Medical Board had interest in some practice there, so it was competition, really. They were limiting their competition. And I spoke to the main attorney for the Texas Medical Board, and I asked her, I said, what are the guidelines? What are the limitations of Texas Medical Board? And she thought for a moment, and she said, well, really, there are no limitations. We can do whatever we see is what we need to do. I think that says it all right there. That's a tyranny. I can't emphasize enough. I have a friend who actually was prosecuted for years over the production of colloidal silver here in the state of Texas. It's gaining a little more acceptance, but years ago you couldn't even obtain silver bandages. That was all considered bunk. Not many years previous to this, doctors would tell you if you were taking vitamins that you were just paying for expensive pee. That did you no health benefit whatsoever. We have one of the most ignorant, programmed, mind-controlled collection of doctors here in this country. I think historically, I'm surprised that they've given up bloodletting, because that's right about where they are. And they don't even realize it. They think they're experts. But you start analyzing how many MDs, since the time they received their MD license, how many of them really kept up with the current innovations in medicine, the medical discoveries. And you'd be surprised how many doctors don't, that I found out. And several of us here in this room had a great friend who is now passed on, who was a former New York Assemblyman, Daniel Haley. He wrote a book called Politics and Healing, in which he gave the historical account of 10 different cancer cures that have been suppressed, that there's plenty of documentary evidence that these things work, that they, in most cases, brought people back from stage 4 cancers, and also in many cases, only treated people who've been given up by the standard medical profession, and in fact, were able to cure them. But it's illegal to even use the term cure now because of the stringent laws we have in this country that the AMA promotes, FDA promotes. And I would just say that there are many different forms of slavery. And this is one of those things. You have a completely, in my opinion, completely destructive, aberrant medical system currently. Unless you get crunched in a car crash or something and you need some emergency surgery, I mean, we have some of the best in the country for that. But I wouldn't be happy about a Mayo Clinic standard for every hospital in the country. I'm horrified by that because it's still within that standard model and it's still subject to standard of care. You think you've got a free medical system and you really don't. And the more you get down to the single payer thing, which I believe Obamacare was designed to fail and then promote us into single payer, the nearer you get to that, the less choice you have individually. And then there's the case of vaccines. The first funeral I went to of a fellow employee's young child who supposedly died of SIDS. He just received his vaccination and he was dead within 48 hours. That was some years ago, and everybody was puzzled, and we were all, feeling very fortunate he didn't get charged legally for the lesions on his son's brain stem. But later on, I was able to videotape Dr. Andrew Wakefield, and this is one of the most maligned doctors in 2 continents here. Wakefield just happened to find out that the MMR was causing autism. Oh gee. So you have now this ramping up of all these recommended vaccines, and yet studies in Canada are showing a connection between cancer and leukemia for these early childhood vaccinations. China is showing all kinds of reductions in even IQ in children in these studies who are receiving vaccinations. So that's just one tiny little window into this abusive system, which has been for many decades all about money and not about the care of the patients.
Yes.
Cool, so rebuttal, I mean, we kind of already talked about that. Yeah, you're right, the corruption in the FDA is crazy. Like, my entire life, that's all I've seen. I've heard about this cure for cancer also. I have many people that have told me about this, and I was like, yeah, if the pharmaceutical companies get to control FDA, they're going to control whatever they wanted to control. So this is we're all back to ethics again. We're all, again, we come back to ethics. Is that ethical to allow that to do that? No, of course not. The FDA should care about all of us, not where its next job for that FDA investigator can be, which is usually going to be in a pharmaceutical company. That revolving door is screwing up everything. All the corruption we see in our government comes from that. That corrupt market injects its corruption into government because of the money. That's where all the corruption comes from. People are corrupt for the money. It's like when people ask me, what's the difference between the forces of evil and the forces of materialism? It's the same. The forces of evil are being evil for materialistic reasons. They're trying to get more money, more land, more transitional power, whatever. That needs to be checked. Yes, we need to fix the FDA. We need to fix, that's some crazy stuff about the Texas State medical program. That seems ridiculous.
Medical board.
Yeah, the Texas State Medical Board should be run by physicians and nurses, not by politicians who say, this is a good idea, that's not a good idea. What do they know? Nothing. They're good at
being a general representation. So you have the experts in front of them telling them, they ask questions, and then they figure out what to do. And then they tell the experts, here, look at this. Is this good? What does this look like? Would this help? We don't do that. Because the experts are the ones building and crafting the legislation. It's the pharmaceutical companies and the corruption that's crafting all the legislation. Whoever has the money crafts the legislation. So again, we get back to ethics. I mean, most of the talks here basically had to do with corruption and ethics and how that would be bad in government. Well, yeah, it's bad everywhere. We have corruption in corporations now too. Why do you think they're behaving that way? Plus, the fact that we tell corporations to maximize profit over everything else is what creates the corruption. We should just change that to make profit. If you want to maximize something, maximize innovation and benefit to humanity. Money will follow that too. Yeah, that's not really much else I was going to rebut. Everyone has some pretty good thoughts. That was great.
Did you have a good time?
Yeah, it was great.
Well, I'd just like to thank Jake for the presentation. It certainly was eye-opening and very interesting, and we now have a program, I think, for the next 3-4 weeks. So we're good to go until Tom comes back. So hopefully we'll see you next week and the week after, and so on and so forth. So thank you and good night.
Yeah.